Hi, I'm Dr. Fano. Today I'll be evaluating your spine from about the base of your skull to your belt line. I will need to expose the skin in that area. Would it be alright if you remove your shirt?
That's fine.
Alright. Alright, can I have you take a seat on the table and face that way? Thanks. Alright, first thing I evaluate is the SI joints, and I already feel a restriction in the SI, in the left SI joint. So I'm going to ask the patient, can you lie face down on the table for me? So in the left SI joint, I'm going to place my fingers in the joint line of the ilium and the sacrum. My left hand will be on the ASIS, and I lift posteriorly to assess for flexion. And I do feel the ilium glide posteriorly on the sacrum. So next I'm going to assess extension. For this, I'm going to lift the patient's leg posteriorly, and I'm feeling for gliding of the ilium over the sacrum anteriorly, which I do not feel. So that means the patient has a left SI extension restriction. And so now I'm going to further evaluate your spine. Can I have you sit up again and face that direction? And I feel another restriction right here. And evaluate. I'm going to check and see which segment. So can I have you flex forward for me? Bend forward. Come back up, and it is the above segment. This would put me at T7. So next thing I do is have the patient cross their arms. I have my thumb on T7, T8 spinous processes, and then I rotate the patient left, spring the joint, and I did not feel separation of the two spinous processes on the left. Upon right rotation, rotate, spring, and there is separation of the spinous processes. So that puts the patient at a left rotation restriction. And next is lateral bending. So for left lateral bending, we are going to bend the patient left laterally, spring the joint, and there is closure on that side. For the right side, you bend the patient laterally right, spring the joint, and it does not close down on that side. So that means there is a right lateral bending restriction, lateral flexion restriction. So our listings for this would put the patient at a P, L, I. And for further evaluation, we're going to assess the ribs on the T7 ribs. So for this, I go up 2 interspinous spaces from T7, laterally 2 inches to put me on the T7 rib. And the first thing I assess is elevation of the rib. So I'm going to go to the inferior aspect of T7 rib. I'm going to flex patient forward and bend left, rotate left, and I'm going to spring the joint superiorly, the rib, and I do feel elevation. And now I'm assess depression. So I'm going to extend the patient backwards and rotate to the right and spring inferiorly. And I do feel depression T7 rib. And then I'm going to move across to the left rib of T7. I'm going to come to the the inferior aspect of that rib. And to assess elevation, I'll flex the patient forward and rotate to the left and spring superiorly. And there is elevation. For depression, I come to the superior aspect of the rib, extend backwards, rotate left, and spring inferiorly. And there is depression on those ribs. So I continue my, you can put your arms down. Continue my evaluation. So there is nothing in the cervical spine, and now I'm going to evaluate Atlas, or C1, C2, in which I come to the inferior aspect of TVPs of the Atlas, and then, back up. We're going to assess if the Atlas is AS or AI. So first thing I'm going to have the patient do is close their eyes and look up and down continually, and stop and put your nose at what you feel is a neutral position. And it is slightly superior, so that puts Atlas at AS. And now I assess lateral bending. I come to the inferior aspect of the TVPs of Atlas. And for left lateral bending, we're going to bend the patient's head to the left and spring through the joint. And I do feel closure on the left. And then I'm going to assess the right side. And so we then laterally bend the patient's head to the right, and there is no closure on the TVP of that side. And so there's a right lateral bending restriction on the Atlas. And now we assess the rotational component, in which come in, place my middle finger on the patient's TVP of the Atlas. I'm going to rotate the patient's head to the left and spring through, and to the right, spring through, and there is a rotational restriction upon rotation to the right. So, listening for the Atlas on this patient with a right lateral bending restriction and a right rotational restriction is going to put the patient at AS, R, and ASRA. ASRA. And that will complete our evaluation.